How does PVR affect your kidney health? Have you ever wondered how the amount of urine left in your bladder after you go to the bathroom could impact your kidney health? This leftover urine is known as post-void residual volume, or PVR. When PVR is elevated, it can indicate urinary retention, which can lead to several complications that affect both bladder and kidney health. First, let's talk about urinary tract infections, or UTs. When there is a significant amount of urine left in the bladder, it can create an environment where bacteria thrive. This increases the risk of developing UTs. If these infections are recurrent or left untreated, they can travel up from the bladder to the kidneys, resulting in kidney infections, also known as pyelonephritis. These infections can damage kidney function over time. Next, consider the impact of bladder overdistension. When the bladder retains too much urine for an extended period, it stretches beyond its normal capacity. This can weaken the bladder muscle, known as the detrusor muscle, making it less effective at contracting. This can worsen urinary retention and lead to further bladder dysfunction. Another concern is the potential for ureteral obstruction. High PVR can cause urine to back up into the ureters and kidneys, a condition known as hydronephrosis. This back pressure can harm the delicate kidney tissues and impair their ability to filter blood properly. In severe cases, this can lead to acute kidney injury, which requires immediate medical attention. Additionally, prolonged urine retention can lead to the formation of bladder stones. These stones can cause irritation and infection, further complicating kidney health. It is important to note that very high PVR volumes, typically over 300 milliliters, are significant and may requiring a specialist's evaluation. Treatment options depend on the underlying cause and may include medications, catheterization, or even surgery to relieving any obstruction. From a broader perspective, elevated PVR may also indicate underlying issues such as bladder outlet obstruction or dysfunction. These conditions should be carefully evaluated, as persistent urinary retention can lead to chronic inflammation. Over time, this inflammation may contribute to changes in bladder tissue and potentially increase the risk of bladder cancer. In summary, elevated post-void residual volume can have serious implications for kidney health. It can increase the risk of infections, lead to urinary tract obstruction, and even cause kidney injury. Early diagnosis and management of high PVR are essential to prevent these complications. If you suspect you have issues with urinary retention, it is crucial to consult with a healthcare professional for proper evaluation and treatment.